All right, good morning. Good morning. I'm here behind this. Even Biden didn't get the glass last night, huh? I got the glass. It's good to see everyone today. Let's get small enough groups. Let's go around. Let me make some introductions. In the back there, we have Bob Wasserback, who's the county auditor. Rob Gurney, is that right? From Lutheran Community Services is here, who's a service provider. Thanks for being here. And I also wanted to introduce several members of the committee who came up with the idea that we're going to talk about today, the grant program we're talking about today. VANESSA PHILLIPS, who's my Chief Administrative Officer, you'll be hearing from her shortly. She was the co-chair of the Health Equities Task Force, along with Alicia Clark, who's here. Thank you for being here. And Julissa Coriano, thank you. You were on the committee, right? Okay, good. About 4 months ago, when we were talking about how to allocate resources in CARES Act, we read an op-ed by Jordan HINES about the inequalities in health across our community and how COVID-19 illustrates some of those inequalities, and governments and community groups need to stand up, find resources to do more about it. So Jordan is here and was a key member of our committee as well. So Jordan, thank you for being here today. If I were to speak about COVID-19, or when I spoke about COVID-19 5-6 months ago, what you would have heard me say is that we're talking about a virus that impacts everyone equally. So much of what happens in our community is done unequally. But when a virus comes, virus doesn't know race, it doesn't know class, it doesn't know religion, it doesn't know gender, it doesn't know nationality. But what we found in the past few months, while that is still true, this virus is exacerbating existing inequalities. It's finding the weakest link in our community, in our chain of health delivery systems, and it's taking advantage of that, and it's killing people. And so it's really important, once we got these resources, thanks to the strong support of Senator Carper, Senator Coons, Representative Blunt, Rochester, federal resources to deploy locally to address the most urgent COVID-19 concerns, we looked hard at these health equities. And the way we did it is we put together a diverse group of community advocates, of course, several of whom are here, and we asked them, what would you do if you had this money to address the problems in front of this? And one of the great ideas they came up with is what we're announcing today. It is a $10 million fund. It's a $10 million fund to address disparate outcomes in health across our community. A $10 million fund to address disparate outcomes in health across our community. Such a large amount of money just for Newcastle County. I don't think it's ever been done before. When in the worst of times, it does give us an opportunity not only to say, how can we protect our most vulnerable citizens? How can we run testing sites like the one right behind us so that we identify those in our community who are in danger or may spread the virus, but also an opportunity for us to look in the mirror and say, what are the long-term issues? What are the things that we've learned from this that we now can utilize and leverage to fix, so that maybe, just maybe, our post-COVID-19 county is quite a bit better than our pre-COVID-19 county. So we're real excited. For those interested in applying, you're about to hear from VANESSA PHILLIPS, who again is my deputy. The secret is that she runs the county while I'm out talking about it. She's the Chief Administrative Officer, and because she didn't have enough to do, we gave her the responsibility as the co-chair of our Health Equities Committee. So please give a round of applause to VANESSA PHILLIPS. Thank you.
Good morning, everyone, and thank you for being here this morning. First and foremost, I want to thank the committee. We launched the committee on June 18th and got started right away. With the help of members of the community, those from the medical community, we were able to share a lot of data as to what was going on across Newcastle County in terms of underlying health conditions impacting people of color. We talked about diabetes, obesity, hypertension, and those are just some of the medical conditions that exacerbated the COVID-19 pandemic in our communities. Special thanks to Jordan HINES for his op-ed. That information really helped us get started with the Health Equity Committee. And special thanks to Bob Wasserbach for attending every single meeting that we had this over the summer. I also want to talk a little bit about the grant program. We designed this program so that it was broad enough to capture the organizations, faith-based organizations, small businesses that are out here in our communities addressing health equities. We didn't put a lot of conditions attached to this grant. However, we are looking for organizations that traditionally address health inequities in vulnerable communities across Newcastle County. We've designated $10 million that the committee will be distributing among the organizations and small businesses who apply for the program, and we will be ranking those proposals over a 2-week period after the deadline of the grant proposals that will be coming in. The grant will be launched on Monday, August 24th, and will stay open until Friday, September 11th. We hope to announce the grant recipients by the end of September and start getting that money out on the streets and to the organizations and small businesses who need it the most to continue to address health inequities. At this time, I would like to welcome Jordan Hines to the podium to give a few remarks.
So there's a saying by Confucius, tell me I'll hear, show me I'll listen, involve me I'll understand. And I want to thank our co-chair, Alicia Clark and VANESSA PHILLIPS, as well as County Exec Matthew Meyer for answering the call of action to create this task force. It's one thing for politicians to create a task force of individuals that think they're involved when they're really not. And it's another to create a task force of individuals that are really in the trenches from various communities, whether it be the Hispanic, Indigenous, African American, you name it. And so I can't thank you enough, County Exec Matt Meyer, for your leadership. I feel that with the CARES Act funding that's going to go out into this community for community organizations, it's just going to enhance moving this community forward. I think the commitment that you showed us by having various people a part of this committee, as well as your leadership being involved with research, looking at data, listening to suggestions amongst all the committee members, really speaks to your character. So thank you so much. So with that, I appreciate it.
Yeah. I also just want to say the names of, just so there's some public record of the names of everyone on the task force, people who really gave of their time. One thing you realize pretty quickly in this, you have a tremendous public responsibility and you want people to be involved, but you depend on people like Alicia and Jalissa sort of raising their hand to say, I want to serve. And I thank them for that. Some of whom said, I want to serve, and some of them got a call from me or someone in my administration saying, serve. So whether you're volunteered or voluntold, let me just read off some of the names, of course, VANESSA, Alicia, Jordan, Jalissa, Sandra Smithers, I call Mayor Smithers out on Route 9 corridor, Mark Clymer, Reverend Shanika Perry, Jacqueline Ortiz, Gwen Angelette, Delcy Morales, Dr. Robert Hall, Lacades Todd? Lacades Todd, Dr. Sidney Teal, Dr. Eunice Guanmesia, Taylor Burge, Dr. Rose Kakoza, Mwidifu Dibal, what was that? And Dr. Shauna McIntosh. Give them a round of applause. It's also, of course, a good opportunity for people who may not often interact with county government to interact with county government. Without further ado, let's get as many people up here masked with a photo who are on the committee. Come on up, take a quick photo.